Are you new to the field of EMS? When you're first beginning, it seems like there's so much to remember. Don't forget to put your gloves on. Don't forget to get a history. Don't forget to check that blood sugar. And the list goes on. In this video, I'm going to break down 7 specific things to remember on every EMS call that will ensure patient advocacy and self-preservation. Stay tuned. If you like this sort of content and you love all things EMS like I do, be sure to hit that subscribe button down below. And while you're down there, hit the notification bell to be notified when I post a new video like this, and I do it every single week. All right, guys, let's jump right in. A common misconception of the public and even those new to the EMS field is that EMS is easy. From their point of view, we go to the patient's house, pick the patient up, and take them to the hospital, and then we're done with them. But that's just simply not true. In this small time frame, which depending on what service you work and how far they travel, could be a long time frame, there is so much that can go wrong with this patient. So in this video, I'm gonna break down some of the ways to prevent absolute catastrophes on EMS calls. Here we go. Tip number 1, your safety is the most important of all. How did we learn it in school? We learned our safety was most important, then our partners, and then our patient, and then everybody else. But this doesn't just go into PPE and putting on your gloves every time you go to a call. This starts with even just asking dispatch pertinent information that's gonna help you know what you're getting yourself into. This is utilizing everybody on your crew, everybody on your team to keep an eye out. Look for suspicious things. Look for people that may be acting suspiciously. Look for pets that may be aggressive. Keeping an eye out of your surroundings at all times. This is watching what kind of structure or what kind of environment that you're entering. For example, are you going into a mobile home that looks really run down and it looks like the body weight of your 3 crew members, a gurney, and a monitor are just gonna make the floor absolutely collapse? This is something you need to be aware of. This could harm yourself, your crew, and your patient. It's also asking law enforcement to escort you or to even ride in the ambulance with you if you have a patient that acts like they're combative, a patient that's altered, drunk, high, whatever it is. If you feel unsafe, don't be afraid to ask law enforcement for help. It's making sure that needles aren't left exposed. How many times do we hear that, but maybe set down a needle after we've given an injection? No, it should go straight into the sharps. And this isn't to be a stickler. This is to prevent something harmful from happening to us. Also, this is using the proper technique when we're lifting or moving our patients. Ultimately, forgetting all of these things or some of these things could get you killed or injured. Please, please, please remember your safety is number 1. Number 2, when all else fails, fall back to your ABCs: airway, breathing, circulation. If you haven't already been on one of those calls where you have a moment of like, for lack of better words, what the heck is going on? You may not know what's wrong with the patient. You may not know how to treat them. So when you have moments like this, always fall back to your ABCs. Is their airway patent? Are they able to breathe normally? Are they adequate respirations? Is their circulation intact? Is any external bleeding being controlled? Have you established IV line? Are you giving fluid? Don't try and go high speed right off the bat. Just start with the basics and treat your patient. Tip number 3, listen to your patient. A patient knows their body better than you know their body. If a patient is insisting not to get an IV where you've chosen because every time they get stuck there, it blows, chances are they aren't lying. Listen to them. Choose another spot. If a patient has lost a lot of blood and they're saying that they feel like they're gonna die, take them seriously. They're probably feeling shock within their body. Make sure that whatever your patient, and granted, I know that there are situations where some patients can be dramatic and things of that nature, but we have to treat our patients' complaints and we have to treat them like all of them are real. Listen to your patients, guys. They know themselves better than you do. If you're liking these tips, make sure to comment down below your favorite tip of the 7 that I list. Every patient that you treat was or is somebody to somebody. Something very important to remember when you go on these calls, especially with the elderly, but it can be any age group. Remember that they once were or currently are somebody to somebody, and take good care of them. Take care of them like you would your own family. This can be hard to remember, especially when a patient treats you poorly or a patient's family treats you poorly, or whenever a patient is just like extremely whiny or needy, when you're tired and you know that this frequent flyer that you've run on 5 times in one shift is in no immediate danger and it's truly not an emergency, it can be hard to remember this. But an example I always use is a lot of times we run on elderly patients that may have Alzheimer's, they may have become nonverbal, they may just be really stoic or even a little bit combative. You have to remember this once was somebody's wife, mother, daughter, sister, or father, son, brother. You have to remember this when you treat them. They may seem like just a patient to you, but they are somebody to somebody. Complacency in EMS could injure, kill, or really embarrass you. In EMS, complacency is your enemy. It is so easy to become complacent because a lot of our calls are repetitive and not really serious or super complicated. But complacency can affect all areas of EMS, and it really can kill or injure you. Some examples of this is, how many times have you gotten out of the ambulance and not checked to see if traffic is coming or if a barrier has been placed to protect you from traffic yet? I've done it, I'm not going to lie, and that right there is complacency and not being aware of your surroundings. Complacency can come in the form of getting too close to a patient that is obviously confused or altered, maybe just coming out of a seizure, having a low blood sugar, getting too close to them, because as we know, those patients can become very defensive or combative and really injure us. I always think of this teacher that I had one time. He told me that he went on a call and he got there and the patient was unconscious, unresponsive, and had an extremely low heart rate. He never told me what it was, but it was low, and a low blood pressure. En route to the hospital, he started to pace this patient, which if you don't know what pacing is, it's for bradycardic or slow heart rhythms to speed it up to a normal heart rhythm. So he arrives at the hospital to drop this patient off, being paced, and the first thing the hospital does is check the patient's blood sugar because he hadn't. And the patient had a very low blood sugar. They stopped pacing him, gave the patient glucose or D50, and the patient woke up and was fine. So my teacher said, and he didn't say it in these exact words, but he basically said, don't be the idiot that I was. Don't show up pacing a patient that all they needed was D50. And I always think about that. That's just complacency. Number 6, don't expect to make a difference on every single call, but always strive to. Many times as a provider, your effort to improve the situation of the patient doesn't help, and that's okay. We're there to do a job. We have to try to do it, and if it doesn't improve, we know that we did the best that we could. So always strive to make that difference. Your effort may go unnoticed on these calls, but don't do it for the glory. Just the fact that you could help somebody should be fulfilling enough. Number 7, and the last thing I want you to remember when you go on EMS calls, is to talk about it if you need to. There's a stigma in EMS that you have to be hardened to sad things or that you need to toughen up, and this isn't the case. You never want to lose your compassion for your patients, and if something really does bother you, because EMS does have an ugly side and you do see very awful things, talk about it. Get in the ambulance after the call and talk to your crew about it. Talk to your family, your friends. If you go to church, lean on your religion. But even aside from the heavy stuff, talk about what went down on every call, because that's how you learn. So if you come back from a call and you don't know why a medication was used or why a treatment was done and you're curious, be sure to ask the members of your crew, especially if they have a higher license than you. You want to get a better understanding of why they did what they did. And if you didn't agree with something, maybe you guys can talk it out then. That is how you learn, and also to grow in the field of EMS. Alright guys, those are just a few words of wisdom that I've gathered from others as I've been in the EMS field, and also from mistakes that I've made, and I truly hope that they help you when you go into this field. On another note, I've had quite a few people ask me for another Q&A, and I would be more than willing to film that for you guys, so make sure to send me your questions. You can DM me on Instagram, you can comment down below. I'd be more than willing to do another Q&A. If you like this video and you want to see more like it, let me know by liking it and subscribing down below, and share it with all of your fellow and aspiring EMS junkies out there. Also, before I forget, please, if you have any more tips of things to remember on an EMS call that I did not cover, which I'm sure there are plenty, make sure to comment them down below. Let's help each other out. All right guys, until next time, bye.